Good afternoon and welcome to this session this afternoon. I would like to introduce you to Duncan Selbie, although he's having problems joining at the minute, so I will introduce him anyhow, and hopefully he will join in a few minutes. But in the interim, and whilst he tries to join up, I will introduce you as well to Jean-Claude, who will be taking the session forward until Duncan is able to join us. So Duncan Selbie, many of you know, and he's hoping to chair this session. He is the president of the International Association of National Public Health Institutes and also is a senior advisor to the Saudi Public Health Authority. His public service career spans over 41 years in Scotland and in London, and he was the chief executive of Public Health England from 2012 to 2020. Prior to this, Duncan was chief executive of Brighton and Sussex University Hospitals, the regional teaching hospital for the southeast of England, and prior to that he had quite a few jobs as director and chief executive in the NHS. I would also like to introduce you to Jean-Claude Desenclos. He's the General Secretary of IANPHI. He moved to public health in 1988 after several years of medical general practice and international humanitarian involvement through Médecins Sans Frontières. After working for 3 years at the US CDC as a medical epidemiologist, he joined the newly created French National Surveillance Institute in 1993. He has had numerous jobs since then, and at the minute he's retired, but very, very active in the field of public health, and he keeps a part-time position as scientific officer at the Public Health Agency. Dr. Desenclos, I would like to hand over to you for chairing this session until Duncan is able to join.
Okay, thank you very much, Raquel. So I have to. Good afternoon, everyone. I have to do two jobs. Make the introduction that Duncan was supposed to do, and I got them. So I will briefly make the statement that he wanted to make, and if he joined in, I will give the floor to him. So thank you very much for joining us and inviting us to the PHE Research and Science Conference. We are honored to launch the IANPHI strategy at this occasion. By the way, the report of the IANPHI strategy has been put online today. At the end of last year, Duncan was elected president of IANPHI, that is the International Association of National Public Health Institute. IANPHI was established in 2006, quite a few years ago, to transform existing National Public Health Institute and to assist countries without National Public Health Institute to develop them. Currently, it has 110 member institutes across 95 countries and the four regional networks, one in Africa, one in Asia, one in Europe, and one in Latin America and the Caribbean. Which benefits more than 5 billion people on 5 continents. So we can say that we are present in many points of the world. Our member are National Public Health Institute, which focus on the major public health problem affecting the country and who are directly involved in building public health within the context. IANPHI mission as a global network is to collectively build public health capacity and capabilities by connecting, developing and strengthening national public health institutes worldwide. Peer support has been used a lot in the last 10 to 15 years and is a powerful tool to build lasting professional partnership which can endure without large funding. I don't see Duncan is there? No, I'll continue. Amongst many duties assigned to national public health institutes, they are critical to strengthening capacity for national, regional, and global health security and preparedness and response to public health emergency. They are also critical for assuring health equity and social progress. Our network provides a platform which strengthens global partnership and in turn strengthens public health system globally. COVID-19, for example, has taught us that the need for strong links between national public health institute or equivalent public health bodies was crucial for sharing data, evidence, and research as the pandemic progressed, as well as for learning from each other. This global collaboration and meeting of minds is something that we must build upon, strengthening the partnerships that have been established to ensure that we not only build back our national system better, but we also build improved international collaboration through this operational network. Cooperation across the globe has never been so important to achieve global health security for each and every one of us. IANPHI has worked with WHO for many years to support the aim of strengthening national public health institute and health system in turn. IANPHI is also a WHO collaborating partner in emergency preparedness and response, including the ongoing COVID-19 preparedness and response. More generally, WHO Collaborating Center houses in many national public health institutes have been producing and sharing important information this past month, including on health inequalities linked to COVID-19. IANPHI members host 87 WHO collaborating centers. We also work closely with other regional organizations, such as ECDC, the European Center for Disease Control, and Africa CDC, and also the CARPHA, the Caribbean Agency for Public Health, as examples. We are delighted to have the opportunity to share with you our IANPHI strategy in the next 15 minutes. The strategy has been developed during the COVID pandemic and is a great example of how we can work together to further a collective goal, in our case to transcend the role of National Public Health Institute worldwide through the work of IANPHI. This strategy is critical and very important for IANPHI. It signals the next phase of IANPHI development, and upon which we will develop a work plan, and I will get into the presentation of the strategy. I just wanted to thank a few persons that work specifically on the preparing the IANPHI strategy. The IANPHI strategy was developed by a working group involving the members of the executive board and also National Public Health Institute members and also external members of IANPHI. And it was coordinated, this working group was coordinated by Cathy Morgan, Gemma Lien, and Julie van der Wold from PHE, and the IANPHI Secretariat at Santé Publique France. And I think I wanted to thank them for this critical work in putting together what has been discussed in preparation of the strategy. So, if I don't see Duncan, so I will present in 10 or 12 slides the strategy now. So next slide, please. So who we are, I think in the introduction that I made for Duncan, those things were indicated. 2006 is the date of birth of IANPHI. We are a global network, 110 member institution. 4 regional network, Africa, Asia, Europe, Latin America, and the Caribbean, which has been developing in the last few years, are very critical way of now working within IANPHI. We facilitate between public health institutes across the world, the globe, and IANPHI works with partners such as WHO to support and advocate for strong public health system. The word advocate is something that is new in the strategy, and I will come to it in a few minutes. Next slide, please. So our mission is to collectively build public health capacity and capabilities by connecting, developing, and strengthening national public health institutes worldwide. Our vision is a global community of interdependent and trusted national public health institutes as scientific advisor. Scientific, I think science is at the core of IANPHI in order to advise and working together to protect and improve the public health and build on a more equitable world. And our value is an inclusive and independent professional association. I think the word independent is very important, which promotes an evidence-based, again, based on the science approach to public health and scientific excellence. Next slide. Thank you. So the purpose of the strategy, three issues that guided it. First thing is that IANPHI evolved in its statute, and we have now a statute of as an international non-profit organization. And it was one argument we needed a strategy to direct the strengthened capability of IANPHI to engage in collaboration to benefit better public health. We wanted also to present a public-facing strategy, to have a strategy and to indicate IANPHI role as a key actor in public health will be shared with international partners. We need to that people know about our strategy, and this is important. And the last point is to support members through transition in public health. There's many things has been going on in the last few years as public health challenges, and COVID-19 was one of them, which was unexpected, but will have important consequences on public health. And this is an important issue that we have in this strategy. Next one. So the development of the strategy was based on IANPHI members and with a working group and a lot of interaction to prepare through and with the coordination through the Secretariat and Cathy Morgan, who coordinated it. We had a lot of interaction, and also we had feedback from WHO Health Services Resilient, from WHO Security Preparedness, from the Associations of School of Public Health in the European region, the Euro Health Network, the Bill and Melinda Gates Foundation, which made a couple of critical comments and suggestions, and the Caribbean Agency for Public Health in the Caribbean. Next one. So there are 5 components of 5 strategic priorities. The first one have to deal with professional relationship. The second with the collective expertise of members. Engage and support and grow IANPHI diverse membership is the third one. Advocate globally and at country level for National Public Health Institute as key health actor, and of course the last one that is in support of the 4 other one is build an agile association to support the work that we want to promote. So I will get into a bit of details of each of the strategic priorities. Next one, please. So the first one is to strengthen the professional relationship within IANPHI Unique Global Forum. Next one. So a few a few issues that will be that will guide our priority and plan. Is the first one is IANPHI annual meeting to ensure that it offers innovative networking opportunities. Annual meeting are key moment for developing and pushing further the activities of IANPHI. Facilitate thematic working group for strategic development and identifying innovation and best practices. Best practices are a very important issue, including the public health impact of inequities and environmental change. Invite leaders from a broad range of disciplines to targeted discussion with members to enable National Public Health Institute to access organizational capacity building information and share best practices. Promote participation opportunities in IANPHI meeting to support the diversity of national public health and the involvement of women leaders in public health, and develop an annual program of webinar and workshop at global and regional level to build our member experience, including national public health response to COVID-19 pandemic. We have done that last year. And this year we have now getting into routine into such webinar, which are well attended. Sometimes they are done at the regional level, sometimes they are done at the global level. Next one. Harness the collective expertise of members to develop public health capacity globally. Next one. So key point, one of the key action which we are starting to undertake is to review the framework of the creation of and development of National Public Health Institute, and particularly the National Public Health Institute core function attribute to understand national public health capacity building needs and the lesson learned from the COVID-19 pandemic. This we have worked. IANPHI has worked on this aspect at the right beginning of the creation of IANPHI, and we feel that there is a need to come back to this very important aspect. And this will particularly be supported by the National Public Health Institute of Germany, or the Robert Koch Institute, which is interested in working onto that. Develop new and strengthen existing partnerships at global and regional level, and particularly with WHO, to facilitate collaboration through joint program of work and to collectively advance public health science to prepare the new public health challenges. We have had discussion for some months now with WHO to find the best way to interact with them at the Geneva level, and this is work which is still in progress. Raise awareness for further develop and assess the impact of tool best practices, resources, and guidance produced by IANPHI. We have developed those tools. We need new one, and also develop and adjust the ones that we have been developing. Developing also IANPHI training resources in ranging disciplines that are complementary to existing resources, and the last aspect is to promote, facilitate shadowing, mentorship, and second-man opportunities to enable twinning between member institutes. This has been very critical in the past, and we wish to push that further. Next one. Strategy priority 3. Engage, support, and grow IANPHI diverse and unified membership base. Next one. So, as I said, we have 110 members, which are in 95 priority. We need to map, and we have started to do that national public health at all stages of development across the world to engage with prospective members and grow the membership base. We are working to get new members, particularly from Russia and from other countries where we know that there is a National Public Health Institute institute, or there are sometimes several, and we try to get them as new members. Increase also the visibility of IANPHI services for new and existing members to enable National Public Health Institute to receive tailored advice and assistance to strengthen their public health function and capacities. Develop also comprehensive regional level work program, which is a critical issue for the next few years. We have quite a lot of activities that are going on at regional level, and we need to find a better way of supporting them in achieving their goal and their activity. Adapt the peer-to-peer evaluation tool, which we had developed 7 years ago, if I remember, and to adapt to the varied regional context and scope of remits in IANPHI to ensure that members can participate on an equal footing. And ensure interpretation. IANPHI members are very diverse and diverse also in language, and this is a key issue to offer interpretation at each meeting so that we can better communicate and facilitate exchange. Next one, please. So this one relates to advocacy globally and at country level for National Public Health Institute as key public health actors. Next one, please. So advocate for the strengthened role of National Public Health Institute in supporting healthier population worldwide. Facilitate discussion between members and international, regional, and specialized organizations, particularly WHO and its regional office, to develop joint collaboration and messaging, and identify all opportunities to promote the importance of National Public Health Institute. Develop a National Public Health Code of Practice, which is led by the National Public Health Institute of Norway, which we are starting to develop. That, and this code of practice would include core values such as scientific independence to support members at their national limits, and produce evidence and position on the role of an impact of National Public Health Institute. This is particularly important following the COVID-19 lesson learned initiatives that we had last year and at the end of this year, and we shall go more into those activities of producing those evidence and to foster advocacy of national public health based on scientific advice and science. Next one. So the last one is to build an agile association that does not cost too much, but support members through change, but it costs a bit. Next one. So develop a fundraising plan, including national public health and partners, to ensure the support of IANPHI strategic priorities and membership is sustainable. Sustainability is something very important, but we need to do more, and we need to find appropriate resources. Not too much, but it's not very much money, but we need some for that. Regularly lead also horizon scanning activity to identify innovative competence and emerging public health role and partners. Organize national public health lesson learned exercise. This has been the one that we did on COVID-19 is really quite unique, and we get some lesson from all over the world, and in the regional context is quite unique as for structures like National Public Health Institute. Develop an online knowledge platform and continue strengthening the digital tools that we have been developing. Next one. So now we are where we are in the steps of the strategy. For the strategy, we have the strategy has been published today on the website, and it has been presented the first time at the PHE conference, which thank you very much for inviting her for that. The action plan is we are in the stage of getting into implementation, and we are preparing a plan of action, and this will be reviewed and validated at the IANPHI General Assembly at the annual meeting to review progress and plan going forward. But the strategy is already being implemented through some action and that I have mentioned in the previous slide. And next one. And thank you very much for listening to me. Sorry that I had to speak from the start, and we will get now into we have three invited National Public Health Institute director or members that will say a few words in echo to what I have said and the presentation of the strategy. Maybe I give the floor to Geneviève Chêne from Santé Publique France, who used to be my boss, and who will and so I invite her to comment and make a few points from his experience. Geneviève?
Yes, good afternoon, Jean-Claude, you reveal our main conflict of interest from the beginning, which is of course a positive one. So good. Thank you very much for giving me the floor at this important session for IANPHI. I must say that, I know we are all sharing this. This crisis has shown how much we need public health, and so thank you very much to Jean-Claude and to IANPHI members for putting together this strategic document, as it is crucial, of course, for our family. I think Duncan would have said family, for our association to strengthen visibility based on an ambitious, very ambitious vision for public health. I may comment by two main messages, in fact. The first one is that my reaction around the preparation of the next pandemic is that we must include in that preparation ending the current one. And we, as National Public Health Institutes, are at the front line of the response to the current pandemic, of course. We know also that the efficacy of plans to prepare for the next pandemic are correlated with our capacity to end the current crisis. So this would involve two aspects for National Public Health Institutes. First, to proactively act on the short term and support each other. So in the solidarity in the family, support each other in the different activities we still have to anticipate and deploy in the next month to come, as this crisis is durable. Second is related to preparation and ending the epidemic, is to evaluate the consequence of COVID, of course, on other health dimensions, of course, chronic conditions or mental health, but there can be also positive aspects that we need to value. And so, of course, we need to respond, as public health is so important, we need to respond by prevention and strongly and durably. My second point would be to underline that IANPHI should be an even stronger voice for national public health institutes and PA and public health experts. So because these institutes at the national level have a unique experience and a critical mass of public health scientists and experts. But their role, their missions, their values are not enough known, acknowledged, though they should be in the position to influence all matters related to public health, nationally and internationally, at WHO, for example. So my proposal, perhaps to go a little bit further than the already ambitious plan for the strategy of IANPHI, is to suggest that IANPHI should advocate as a goal that each country should have a National Institute of Public Health based on national public health core functions and essential public health functions. In a sense, IANPHI could act as such, as a sort of federation, maybe a kind of union of the national public health institutes. So that's my my reaction, and thank you very much for giving me the floor to react.
Thank you very much, Geneviève, for your support and your perspective on that issue. And I think we all share that dimension. Juan, a few words.
Can you hear me?
Yes.
You can hear me?
Yes.
Great. Well, thank you very much, Jean-Claude, for presenting the summary of the strategy and also for giving me the floor. And good morning or good afternoon to all participants. So as General Director of the National Public Health Institute in Mexico, I would like to state that we are eager to participate in the implementation of our updated strategy for the next 5 years. We really share and are committed to our mission, our vision, our values, particularly on keeping public health institutes evidence-based to apply to public health. And I would like to reflect on the fact that the COVID pandemic, I think that has really emphasized the need for public health and global collaboration. I think that more than ever, all the leaders in the world value now public health, and also I hope, the need for international collaboration. And I think that international cooperation is the only effective way to provide a set of global public goods that are essential for a successful global response to the pandemic. And I think that we are now facing the vaccines issues that should be a global public good and should be really distributed to everybody equally. And I really think that our association of 110 institutes in 95 countries and the collective experience that all these institutes have and the diversity of the institutes, it makes us in a unique position to facilitate collaboration across the globe and to strengthen public health globally, of course, in collaboration with WHO, other international agencies, and also to foster discussions about lessons learned from international experiences and to integrate all these good practices within our network. And I am very confident that following our updated strategy, IANPHI can collectively contribute to learn from the COVID pandemic experience, our experiences, because I would say that experiences were different in different countries, and to assist government to strengthen global health security, to improve our preparedness and response to future pandemics, and of course other health emergencies. And then a little message as my role as treasurer. Well, first of all, I think that we need to be very clear that we need to raise funds in order to support our strategic priorities as a first step. But the second one is that in our budget planning process, we are already considering, besides the routinary expenses, consider the budget in terms of supporting the priorities and the activities from our updated strategy for the PHE next year. So I really hope that with this new strategic plan, IANPHI will be in a much better position to accomplish our goal of improving public health across countries. So thank you very much, Jean-Claude.
Thank you, Juan. I will move for a few words from Quentin, who has been leading the European IANPHI network, to say a few words from the work that he has been doing in the last few years in coordinating this network. Quentin?
Thank you, Jean-Claude. It's very heartening to see the strategy launched today, and I'm grateful to Public Health England for giving time at their conference for us to do so. Until relatively recently, I was the executive lead at Public Health Wales for our membership of IANPHI, and as Jean-Claude has just said, I've just completed a term of office as the chair of the European Regional Network of IANPHI. And my reflections are that the strategy couldn't come at a more timely place in the development of public health. Previous speakers have reflected on the pandemic, and I don't think we can overstate the significance of the pandemic in raising the profile of public health here and now in terms of the response. But I think over the months and years ahead, hopefully this will be reflected in a global commitment to an appropriate investment in public health so that we can mitigate, if not prevent, pandemics of the type we've been experiencing in the future. Now, having chaired the European Regional Network, I'll just pick up on a couple of themes that have been identified by previous speakers. The first is that we have agencies and partners who recognise our value and are very keen to work with us. We've mentioned WHO, and WHO in Europe has worked closely with IANPHI in Europe now for over 5 years. We've delivered together practical resources such as guidance on the merger of public health institutes, and we, IANPHI in Europe, are currently supporting the European Programme of Work, which is the 5-year strategy for the WHO in Europe. But we're also working with other agencies. ECDC has been mentioned, and also agencies that you might be familiar with, but perhaps don't get as much mention, such as ASFA, the Association of Public Health Schools in Europe, and they are critical because one of our biggest challenges historically, and indeed even as we look ahead, is building public health workforce capacity. What has come out of those discussions, and particularly within the last year in response to the pandemic, is that there is now not only a recognition of the importance of public health, but the importance of national public health institutes as a voice for public health in countries, and the importance of those institutes being able to advise at country level across all the domains of public health. And I use that word domains deliberately as I'm speaking to a largely UK audience who will understand what I mean by the domains of public health practice, because we won't have global health security without effective prevention and health promotion. It cannot just be strengthening our health protection capability. But we also know from our last year's experience that we need more effective collaboration. Our partners recognize this for themselves, and they're looking to us, and that expectation on us to be able to come together collectively to respond is growing by the day. And I guess my last point is that in this context, the strategy addresses all the right things, but its biggest challenge is simply going to be its ability to deliver. The ambition is high, the expectations of our partners are high, and as a chair, now with learned experience of both the frustrations, but also the commitments of some of our member institutes, it is clear that we are going to have to invest in IANPHI itself if we are to fulfill both our ambitions and the expectations of us. And that is, as Juan has just said, an issue that we will be giving considerable attention to over the next months and years. I'll stop there because there will undoubtedly be questions, and I'm happy to take questions.
Okay, thank you very much, Quentin. We are running a bit of time. There's one question, and also Raquel also has a statement from Duncan to read out. So maybe Raquel, could you give the statement from Duncan, and maybe we can take one question.
Thank you, Jean-Claude. More than happy to do this. So unfortunately, as Duncan has said in the chat, he's been unable to join because he's had IT problems, and he just wants to convey his apologies for not being able to join us today, saying that IT systems often fail us, and it's part of life. So we do really appreciate your kind words, Duncan. He would like to give a big thank to Jean-Claude for standing in. IANPHI is a huge force for good and has been strongly supported by national public health institutes and agencies across the world. The new strategy is a product of intense collaboration led by Cathy Morgan and by Duncan, and he's immensely grateful to her and to the international team that prepared it. Now that we're moving to implementation, and there could not be a better and more appropriate time, he's looking forward to being involved with this implementation and working across with the IANPHI colleagues. Duncan would like to give everybody his warmest best wishes, and especially to PHE colleagues as well, for whom he will always have the profoundest respect and affection. And that's the end of the message. So thank you very much, Duncan, for that message.
Thank you, Duncan. We miss you. We would have. I was not expecting that I would have to play your role in this in this session, but we are also extremely grateful to the energy and the interaction that we have with our new chair, and I guess it will be also critical in the implementation of the new strategy. So if we have the possibility of taking one question, is that possible, Raquel? Could we do that?
Yes. So if I ask the question, and I think in the post Neil has answered it, but there's a question from Rebeti Falkay. What and where do you see the role of IANPHI in promoting collaboration and knowledge exchange for climate change? Do you want me to read Neil's answer and then over to you, or
I can give the answer orally. We are working on that as a IANPHI group, which has been in which PHE is involved and a few others, and to develop. And there has been a couple of interaction and seminars to develop at the climate conference issues related to public health, and this is something that we are moving to now, and I think is very critical and very important work to promote and to involve National Public Health Institute, particularly those who are less resources in countries from the south. Yes, this is an important issue to move forward, and to have also some kind of to put forward the issue of health, consequence to health, and how to reduce the impact and prevent the consequence of global warming, and particularly heat waves, but not only. Okay, I think Raquel, do we have any? I think we need to come to an end, I guess. It's we have a bit 5 minutes above time. Do we have?
We probably have questions. Time for there's one more question that we maybe have time. Yeah. And there's a question from somebody else that actually asks: is there a need to make a difference or to differentiate between IANPHI from WHO, particularly if seeking funding?
Yes, I think one thing is WHO is very, very interesting in having us in supporting what they are doing, and they consider that as an association of National Public Health Institute all over the world, we have something to bring and to the table of developing the global strategy. And so we are trying to find the best way to be part of at the table, in particular to raise issues from the experience of National Public Health Institute. We have a small problem to resolve, which is IANPHI is not an NGO; it's an association of government institutions. So. And they don't have this type of association. So we are moving, but I think it's a critical voice, and getting into advocacy, I think, is important. Advocacy of the need for a strong National Public Health Institute for scientifically based evidence to move into protection and prevention, and I think we hope hopefully we'll get that very soon, and also being better recognized by WHO. It's not that WHO will give us money, but it will facilitate support from other donors to support our activities worldwide.
Thank you.
Yeah.
Shall I close this session, Jean-Claude? Or
yeah, it's I think we have to follow you. We are invited by, and you are our ambassador at the national at the conference of PHE. And by the way, I have great. I just wanted to thank very much PHE for having us in this session, which coincides with the launch of our strategy, and also all my wishes to PHE, and thank you very much for that.
Thank you, Jean-Claude. It's been lovely that you've been able to join this session and to launch. For us, it's a privilege that you've launched the strategy at our conference. So we're really, really grateful for you to do this. I think as a public health agency, for us, is the outputs from your strategy are key to our work, and we look forward to being able to read the strategy, but also to continue to work with you over the coming years in participating in IANPHI, and as we move from PHE to the UK Health Security Agency, we hope to continue to have an active role as we've done so far. There's a link on the chat for those that are interested in accessing the strategy. And as Jean-Claude said, it's been published today, so please access that. And Neil Squires has also answered some questions and provided some commentary in the chat if you have time to look at it. So I would like to really thank you, Jean-Claude, for stepping in and chairing this session without having prior warning that you would have to do this. I would also like to thank Geneviève Chêne and Juan Rivera and Quentin Sandifer for their reflections on the strategy, which have been very thoughtful and really interesting. And also, obviously, I would like to thank Duncan, who unfortunately didn't make it today, but I know that he's been listening in. So thank you all, and we do look forward to future collaborations as we move into the future. So I would like now to close the session, and I hope that all of you are able to join other sessions in the conference, and wish you all a pleasant afternoon and evening. Thank you very much.
Thank you.
Thank you. Bye.
Thank you.
Bye-bye.
Bye-bye.